Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. And I welcome you to a brand new week. How was your weekend? Hope you had a nice time with family and friends. Well, last week I mentioned that I'll be continuing the drug use series, and today's topic will be drug use in breastfeeding mothers. Okay, we've talked about drug use in pregnancy, drug use in pediatrics, and this time we'll be continuing by talking about drug use in breastfeeding mothers. Of course, you know that we have mentioned drugs that are not tolerable in children or they are contraindicated. The reason behind avoiding some medications for use in breastfeeding mothers is because some of these drugs actually are passed from the breast milk to the child during breastfeeding. Some are metabolized and they pass into breast milk, you see, and they could affect the baby adversely. Others, there is this scare that they might affect the baby. So there are ways around it, which is what I'll be discussing on today's episode. So without further ado, let's get right into it. When women who are breastfeeding have to take medications, they wonder whether they should stop breastfeeding, and the answer depends on the following. 1. How much of the medication passes into the milk. 2. Whether the medication is absorbed by the baby. 3. How the medication actually affects the baby. And 4. How much milk the baby consumes, which depends on the baby's age and the amount of other foods and liquids in the baby's diet. You know, it is advisable that you exclusively breastfeed your child for the first 6 months of life, because the breast milk contains a lot of substances that boost the child's well-being, development, and most especially immunity. Using medication within this period may be tricky, which is why you need the right information to be able to navigate. Even when you need medication, you can't, because you're breastfeeding your baby exclusively, neglect your own health as a mother. You may actually need to take medication within this period, so you have to know how to navigate, which is why your healthcare providers are there to guide you, and this podcast is here to give you the right information. So you might ask that, do all medications actually pass into the breast milk? Well, almost any drug that is present in the blood will transfer into the breast milk to some extent. Most medications do so at low levels and pose no real risk to most infants, but there are exceptions though. Some drugs can be found in high levels in breast milk. So as a result, every medication must be considered separately. Now, you may also wonder that, do infants' health and age determine how they may be affected by medication in breast milk? Well, it's part of the factors that I mentioned earlier. So the answer is yes. Exposure to medication in breast milk poses the greatest risk to premature babies, newborns, and babies who are medically unstable or who have problems with kidney function. However, medications used in the 2 days after childbirth transfer at very low levels to the infants, because you produce limited volume of breast milk during this time. So the risk is lowest for healthy babies 6 months and older. Do you understand? Not for neonates. Neonates are exposed to the greatest risk, but the risk becomes lower as the child grows. Babies 6 months and above are exposed to lower risks. At this age, drugs metabolize through the infant's body efficiently. Neonates have lesser efficiency to metabolize medications because their organs are still very new. They are still growing. But once they attain that 6 months, which most times mothers would have stopped exclusive breastfeeding at that age, you understand, the child would have been taking other forms of food. They might not be exposed to much risk from getting medications transferred to their body through breast milk. You understand, because they have other things they are taking in. Even if you breastfeed your child exclusively till 6 months, that doesn't mean that you stop breastfeeding at 6 months. You still breastfeed them for up to 2 years in some children. It's only that the breast milk is not the only thing they take in. Do you understand? So other foods may actually caution the effect of that medication passed to the child in the breast milk. Mothers would wonder, should they stop breastfeeding while taking medication? No, that is not the answer. Like I said, there are ways to navigate it, which I'll be telling you today. I would actually be mentioning medications that you should watch out for while breastfeeding and ways by which you can actually manage it. But the fact remains that most medications are safe to take while breastfeeding, and the benefit of continuing medication for a chronic condition, for example, may outweigh any potential risk. Remember risk-benefit ratio in any drug therapy, okay? But a few medications still are not safe to take while breastfeeding. So if you're taking a medication that could be harmful to your baby, you have to talk to your healthcare provider. They might recommend an alternative drug, or they might recommend breastfeeding when the medication is at low level in your breast milk, okay? And sometimes it may be recommended that you stop breastfeeding temporarily or permanently, depending. So the recommendation can actually depend on how long you need to take the drug. And if you know in advance that, okay, I have to take this medication at this particular time, you can pump in addition to breastfeeding and store the expressed milk so that your baby does not lack the breast milk when they need it, okay? And if you need to stop breastfeeding temporarily, you can use breast pumps to keep your milk supply until you are able to breastfeed again. Okay, so you should not stop breastfeeding temporarily and just leave yourself like that. You have to keep pumping so that your brain does not get the signal that, oh, this breast milk is not needed again. Then there's an issue with producing breast milk even after you are done with the medication. So once you pump this breast milk during the time you're taking the medication, you are not giving it to your child, you're throwing it away. But if you're not sure that a medication is safe while breastfeeding, just pump the breast milk and throw it away, okay? So now we'll be talking about medications that are safe to take while breastfeeding and those that are not safe to take. All right, so medications that are safe to take while breastfeeding, the first one is acetaminophen, which is your paracetamol. I've established that it is safe in children even from neonates, so it is also safe to take them while breastfeeding. While they may be expressed in breast milk, it may be just a little quantity, and even if it's at large quantities, they will not be harmful to your child. Ibuprofen is another one. It is also relatively safe in children, so even if it is expressed in breast milk, your child is fine. So also is naproxen, okay? That is for short-term use anyway. Once you use naproxen for a short time, you can still breastfeed your baby, not on chronic use. Now, the antimicrobial medications that are safe in breastfeeding, your antifungal fluconazole is actually safe. Miconazole is safe at little amount for a little while, okay? Clotrimazole as well. It's mostly creams or pessaries, so you're safe to use them. Penicillins like amoxicillin and penicillin, they're safe for babies as long as there is no reaction to them. Cephalosporins as well are safe. The antihistamines like loratadine, fexofenadine, anti-allergy medications, that is, they are safe. The congestants like pseudoephedrine, that is in your Sudafed, your Sinofed, they are safe up to an extent, but use with caution because pseudoephedrine itself can reduce your milk supply. So while you are using it for your condition, maybe your allergy, your nasal congestion, just take it as recommended or prescribed. Don't take it beyond the period you have to take it, because later on it can decrease milk supply. We don't want your baby to be hungry, right? Then birth control pills are actually safe even while you're breastfeeding. There are mothers that once they give birth and menstruation resumes after a few months, you want to be on contraceptives so that you don't get pregnant again while you are still taking care of an infant. So you may want to take your contraceptives, your progestin-only contraceptives, or your combined oral contraceptives. They're fine. You can take them even while breastfeeding. But please talk to your healthcare providers first. They'll know which one to give you, which one will work better for you. Okay? Then your gastrointestinal medications or your ulcer like famotidine, ranitidine, they're fine too. Antidepressants, Some are fine, some are not. Okay, I'll be discussing those that are not, but those that are still fine, that are expressed in very minimal amounts in breast milk and will not affect your baby so much, as the likes of paroxetine, sertraline, they're fine. Then for constipation medications, you can take castor oil, alright? They are safe. Even if expressed in breast milk, they will not harm your baby. Okay. Also, your anti-ailments like your warm medications are actually safe for your baby. So if they pass through the breast milk, they are fine. Alright. Anticoagulants like your heparin. If you have to take heparin for cases like deep vein thrombosis, for example, they are also very safe because they have large molecular weight and they do not cross into the breast milk to a significant extent. They are poorly absorbed, alright? Just like warfarin as well, it is still compatible with breastfeeding. Okay. For anticonvulsants, the likes of carbamazepine, phenytoin, sodium valproate, they are compatible with breastfeeding as well. Although you should observe the infant for evidence of central nervous system depression, but available data says that they are safe in pregnancy. But for gabapentin, you have to be careful. You have to get the go-ahead of your healthcare provider before you can use them. So before I go ahead to give you the drugs that you should actually avoid in breastfeeding, let me give you some tips on how you can actually manage drug intake with breastfeeding. Okay, so the tip is take your doses after you breastfed your child. That is, breastfeed your child before taking these medications. Time your breastfeeding to rhyme with the dosage of your medications. All right. So if it's 3 times daily medication, that is, you take every 8 hours, give your child breast milk just before you take your medication, so that in the next 8 hours the drug should have been metabolized. Okay, should have left the body. Even if it will be expressed in breast milk, it will be to a very low extent. Then you breastfeed your child again before you take another dose of the medication. Do you understand? Another thing, like I mentioned earlier, is you could express your breast milk and store it so that you don't have to give your baby the breast milk straight from your breast. You could put it in a feeding bottle and the child will still have the supply of breast milk even while you're taking your medication. You understand? That's another tip. And when you're giving medication and your doctor or your pharmacist tells you that, oh, this medication, you should not breastfeed while taking it, and you know that you have an infant, you could ask them for an alternative. If it's available, they'll give it to you. So it is very important that when you're going to get a medication, women of bearing age or women that have children, please let your healthcare provider know that, oh, I have an infant, I am breastfeeding, so that they will know the appropriate medication to give to you to ensure your safety as well as that of your child. So now let me get into medications that are actually not safe for breastfeeding mothers, that should not be taken while breastfeeding, because they get into the breast milk in large amounts and could actually affect the child adversely. Drug passing into breast milk has to do with protein binding, because the breast milk has a lot of proteins, and these drugs have high affinity for proteins in the breast milk. So they get into the breast milk, get into the child, and they affect the child adversely because of their side effects. And since the metabolism of children is very low compared to that of adults, they may stay in the baby's body longer, causing this effect to prolong. So number 1 is cimetidine. It is an histamine receptor blocker and it is used in treatment of ulcer. Cimetidine should not be used in breastfeeding mothers because it will definitely accumulate in breast milk due to active transport. Okay. Then the analgesic aspirin, it should be avoided due to its association with Raynaud syndrome. I've mentioned that last week while talking about drug use in pediatrics. Okay. Then we're going to antibiotics. I've mentioned the ones that are relatively safe, the likes of the penicillins, the cephalosporins. So the fluoroquinolones, the ciprofloxacin, it is not safe in infants, in neonates, in children that are being breastfed. So avoid them due to the theoretical risk of arthropathies, tendonitis and all of that, because like I said on the episode about drug use in pediatrics, it is considered unsafe in children. Only that when the benefit has been noted to outweigh the risks given. Then tetracyclines as well, the likes of minocycline, your doxycycline, do not use them while breastfeeding because of the risk of dental staining and adverse effect on bone development. Okay. Then fluconazole, I mentioned that it is safe in children of breastfeeding age, but be careful, watch out for adverse reactions in premature infants. Okay. For metronidazole, the use in breastfeeding mothers is actually controversial because exposure may be high, and with high doses it can be expressed in breast milk, okay, giving some adverse reactions, especially gastrointestinal reactions in children. For nitrofurantoin, if you know that your child has been found to be G6PD deficient, that is glucose 6-phosphatase dehydrogenase deficient, it is an enzyme that helps to break down some medications. If your child is deficient in this enzyme, please do not use nitrofurantoin because it can cause hemolysis, that is breakdown of the blood cells in your child. Okay. Also, sulfamethoxazole, trimethoprim, the one we call Septrin, avoid also in infant G6PD deficiency and hyperbilirubinemia. Okay. Now, phenobarbital, it is an anticonvulsant and it should be avoided due to high infant exposure. It could go like very high in breast milk and it is not safe in children. Okay. Then metoclopramide, an antiemetic, at low dose it can be safe, but at high dose there is an increased excretion in breast milk and it might adversely affect your child. So use with caution. Okay. For cardiovascular medications, the likes of amiodarone and atenolol, please avoid them while breastfeeding. If you're on them, ask your healthcare provider the alternative that you should switch to, because those can actually affect the heart rate or heartbeat of your child. Okay. The likes of captopril is safe, digoxin is safe. Okay. Enalapril is safe, metoprolol is safe. Some other beta blockers like propranolol, safe. You see, so there are other options that you could be switched to. Now, for sedatives, diazepam can be safe to an extent. Okay, that's after a lower single dose, but on prolonged use, there's potential for accumulation in breast milk, and this could lead to sedation in breastfed infants. So it's not something that you should keep using. If you have a problem of insomnia, for example, and you need diazepam and your healthcare provider, recommends or prescribes diazepam to you, you have to use it for a short while. Don't look for ways to get it because, you enjoy your sleep more when you take it. It could affect the child's psychological development because it could cause sedation and slowness in your child. The same thing for clonazepam, lorazepam, midazolam, nitrazepam, zopiclone as well. All those sedatives and hypnotics, you should take them for a short time only. Upon prolonged use, they accumulate in breast milk and could affect your child adversely. Now to social drugs. I don't even know why a breastfeeding mother would take all this, because these drugs, they have high affinity for proteins in breast milk. They will be expressed in breast milk. The likes of cannabis, the likes of nicotine, cigarette smoking. Please avoid this while breastfeeding, as you should avoid them in pregnancy, because they'll be passed on to your child. You could just turn your child to an addict without your knowledge. Same goes for caffeine. Okay, low intake could be safe, but upon continuous taking, being dependent on it, if you don't see coffee, you will not be fine. You could be affecting your child adversely. And the last one I'll be talking about is alcohol. While you're breastfeeding, it is very much advisable that you stay away from alcohol. But if you can't do without taking alcohol, please limit the usage to the barest minimum during breastfeeding, because chronic intake may be associated with impairment of psychomotor development. Alright, so just withhold breastfeeding for like 1 to 2 hours after consumption of alcohol, because alcohol does not leave the body as quickly as you think, and it is definitely expressed in breast milk. So imagine that you consumed a large amount of alcohol and your baby is crying for food after 2 hours and you are breastfeeding your child. There's a high probability that you still be passing some of that alcohol to your baby. And cycle impairment is no joke. It could cause your child to not walk when they are supposed to. It could cause the child to not even walk straight when they start walking. And it could even affect their mental development. So consider abstaining while breastfeeding, alright? So these are the medications that you should not take while breastfeeding. I've also earlier on talked about those that are safe for you in breastfeeding, and I hope that this information will be beneficial to you. I also hope that you share with people that you know that have infants that are breastfeeding, that this information will be very useful for. Thank you so much for staying with me up to this point yet again. Alright, please like, share, subscribe, follow, and do all of that on our social media platforms, on the Spotify where I host this podcast, on Apple Podcasts, on Google Podcasts, which will soon become YouTube Music. Thank you so much for your support so far, and I'm counting on you to keep supporting this podcast, to keep making us more visible. Comment, ask your questions, alright? This will help us to even make the podcast more suitable for you. Till next time, stay healthy and God bless you.